So here's the One Team Working COVID-19 update for Saturday, the 2nd of May. So we are still sharing our YouTube channel, The Social Care Diary, and we wanted to share some of the lovely comments we've had back from parents regarding the channel. I've really enjoyed watching the films. Keep up the fantastic work and give my thanks and love to everyone. Must admit we are watching the Social Care Diary on a daily basis, very impressed with the content and feel reassured that Home from Home Care are doing their very best to support our son, all the other residents and the staff. Lovely to see the staff going that extra mile and thinking outside the box to keep all the residents happy and taking part in great daily activities. Well done to the whole team at Home from Home Care. I'm really enjoying the YouTube videos. It gives great comfort to see that all the individuals are coping well, and hats off to how inventive the staff have been to keep things different and exciting during this very restrictive period. What has been the most comforting element of the video is being able to see what's going on behind the scenes. And that's why we're doing the channel. It's about keeping connected with everyone and also sharing that level of transparency across the whole service so that you can see what's happening at the management level, things that are coming out from the services, the creative activities. You can see us reacting to changes in policy and government guidance and how we're then, trying to implement that across all of the services and putting new processes in place, etc. So it again is just about keeping connected, sharing that information and transparency, but also sharing the stories, and we want to keep that positivity. So that's why it's really important seeing the footage come from the homes and seeing all of the smiles and the creative activities that you're planning in the homes, and how you're responding to all of this. So it's really great and parents are really appreciating it. So yeah, thank you so much, and please keep it coming in terms of the footage, and also please keep sharing the channel so that we can keep sharing it with everyone. In terms of frequently asked questions, I'm going to run through these. So what is COVID-19? COVID-19 is a virus that affects the respiratory system. In some people there may not be any symptoms, but they will still pass on the infection to others. Many people will have mild symptoms, but some will become seriously ill and may die from COVID-19. Next question being, why are we required to wear masks at all times when supporting individuals? So as a virus, it can spread easily between people through the droplets in breath, coughs and sneezes, and from touching objects and surfaces that may have the virus on them. You can't see the virus, and as many people do not show any symptoms, you can't always tell if you're around those who are infected. So wearing a mask at work protects you from those you're working with who may be infected, and protects others from you in case you are infected. To preserve the stocks of fluent repellent masks, we need to use standard surgical masks and visors for as many individuals as possible, with the visor providing the fluent repellent element. The visor can be removed when not performing direct care, and the surgical mask can remain in use until the next break or the need to replace it. Fluent repellent masks should be reserved for use with individuals who we know will not tolerate a visor being worn by their support worker. And for clarity, whilst masks are sessional use, gloves and aprons should be removed after each personal or direct care task, as would normally be the case for good infection prevention and control. It's not required to wear aprons and gloves for non-direct care, such as prompting for medications, supporting activity and being in communal areas. What should you do before starting a session wearing a mask? Always, ensure you've had a drink, had something to eat, and you've used the toilet before you put on your mask. It's less likely then you'll need to remove it and replace it sooner than needed. Why is it important to put it on correctly? Well, despite us having wizard water, PPE does not have magical properties. A face mask is to protect your face. In the areas where droplets can be expelled and breathed in, it will not do this effectively around your neck like a scarf. So it is a piece of protective equipment provided to protect you and those around you, so it should be worn correctly. Why is it important to take off correctly? The mask should be removed without touching the front, in the same way that you do not touch the outside of gloves when removing them. So please refrain from touching the mask, and if you do, clean your hands immediately. If you're worried about anything, there is the absence line, where someone can support you through that. There's also the other channels within your services, so speaking to your registered manager, assistant manager, locality who are on site. That there are different channels where you can raise your queries, but the absence line is also there as another forum. Okay. And then just want to share some photos that have come through from the services, which is really great to see. Lovely to see lots of smiles and all the different activities. So there we go. Thanks everyone, and yeah, I'll keep the photos and everything coming through, and yeah, we'll see you tomorrow.